campaign, I'd like to invite Dr. Nados Behano, to please step up for the overview. Okay, it's going to be, yes, please, cameraman, if you can. It's a video, please, let's take a look.
Your Excellency Senator Oluremi Tinubu, CON, First Lady of the Federal Republic of Nigeria, Excellencies, ladies and gentlemen, all protocols observed. Allow me to start by congratulating Her Excellency Senator Oluremi Tinubu, CON, First Lady of the Federal Republic of Nigeria, for launching the Free to Shine campaign. Excellencies, ladies and gentlemen, founded in 2002, the Organization of African First Ladies for Development, OFLAD, is an advocacy organization comprising First Ladies from across the continent. OFLAD collaborates with partners and stakeholders to drive positive change across the continent. African First Ladies, considered mothers of their nations, have been serving as voices for the voiceless, particularly for women and children. Coming together, they decided to leverage their extraordinary visibility, great influence, and pronounced advocacy against issues that affect the most vulnerable of Africa. Excellencies, ladies and gentlemen, Africa has made significant strides in combating the HIV/AIDS epidemic, but children remain among the most vulnerable. The rate of HIV infection among children in Africa is beyond alarming. From the more than 2 million children infected worldwide, more than 1.4 million are found in Africa. We cannot accept this reality, not when we have the tools, the knowledge, and the collective will to change it. Free to Shine is primarily about elimination of mother-to-child transmission and treatment of children born with HIV/AIDS. It is about triple elimination of HIV/AIDS, syphilis, and hepatitis among women of reproductive age. This campaign is about action at every level, local, national, and global. It's about empowering women, engaging men, and educating communities. It's about ensuring that every mother has access to life-saving antiretroviral therapy, that every child is born free of HIV, and that those living with the virus have the care and support they need. The vision of the campaign is ending childhood AIDS in Africa by 2030 and keeping mothers healthy. To achieve this vision, we have to raise awareness about the HIV epidemic in children and the need to prioritize children and mothers and increase understanding on how to prevent HIV and AIDS in children by keeping their mothers healthy, preventing mother-to-child transmission, and ensuring fast identification and treatment of HIV-infected children. Excellencies, ladies and gentlemen, what is the call to action? Every mother's life is precious, and every child has the right to a future free from AIDS. Together we can break the cycle of risk and ensure health and hope for generations to come. OFLAD calls on all of you to join us in this mission and support the initiative.
Please, let's do it again, one more time, please. Your Excellencies, distinguished ladies and gentlemen, I've been asked to invite Dr. Adepobola Basharon from the National AIDS and STDs Control Program to step up to give us a presentation. Just to do a presentation. I've been told that we need to take some testimonials first. Testimonials.
Presentation first. Her Excellency, the First Lady of the Federal Republic of Nigeria, our mommy, Senator Oluremi Tinubu, CON, other dignitaries there present. In the interest of time, let me just go straight to the presentation. So, thank you. So, this is a presentation on Free to Shine, ending mother-to-child transmission of HIV, which is also called vertical transmission. And this is a map of the South-South region. Next. Thank you. So, this background is telling us where we are as a country. So, in line with the Free to Shine initiative. Based on the 2023-2024 NDHS, we have 23% of women attending ANC facilities with 37% not attending. Then, among those in ANC facilities, we have 83% that were reported, while 8% of the facilities that offered PMTCT ANC did not report, and facilities that provide ANC that do not provide either is 9% in Nigeria. Next. So, the NDHS that was just completed in December told us clearly that only 52% of pregnant women in Nigeria attend 4+ antenatal care clinics. Out of this, we also noted that the PMTCT testing increased within 1 year of this administration to 67%, and the PMTCT coverage increased to 63%. But there's still gap. That's why this initiative by our mother is very apt at this time. Next. So, looking at the South-South region, percentage of women who received antenatal care from skilled provider, that's from health facilities. Edo has 96% of pregnant women attending skilled provider. Delta, our host, 86%. Akwa Ibom, 81%. Rivers, 80%. Cross River, 68%. Bayelsa, 68%. The national average is 63%, but the target for our country is 95%, and we're yet to get there. Next. Also, this is telling us the gap. It's like saying the cup is half full or half empty. So this is the gap. The highest gap is in Bayelsa and Cross River, with 32% of women not getting the required skilled provider. Next. This slide is also trying to compare in each state the percentage of women receiving antenatal care plus those that have 4+ visits for antenatal care. And we can see the colors: 80 for Akwa Ibom, 65 for those that have 4+ antenatal clinic. Next. Also, looking at it from ANC testing plus maternal antiretroviral coverage, those that were given antiretroviral treatment when they were discovered positive. For Akwa Ibom, 90% of the women seen in their facilities were tested for HIV, and 64% of those that are positive in the state are on treatment for PMTCT. For Bayelsa, it's 47 that were tested in the facilities, and 23% placed on ARV. For Cross River, 91% of the women living with HIV that are pregnant are placed on treatment. For Delta, it's 79%, Edo 64%, and Rivers 39%. This is the data as of December 2024. Next. So what are the plans? The plans are two majorly. Number one, for the women that attend antenatal clinic, we need to provide adequate test kits and the antenatal care service delivery sites and medicine for women identified as living with HIV. An issue of supply of services are not demand. So we need to push it to them, because once the drugs are there, the test kits are there, they come for the services. The second category, women who do not receive any antenatal care. We need to negotiate better with the community systems to ensure that we include this in the strategy in community entry. The issue is one of demand at community level that we have to improve on. Next. And so the approach is simple. We need to find out pregnant women and make sure they attend the NC. We need to test all pregnant women for HIV, syphilis, and hepatitis. We need to provide medicines to treat and prevent transmission of these infections to the babies. That's to eliminate transmission, and also report all services that have been provided. So we find all, we test all, we treat all, and we report all. Next. So to address some of these, even after this session, we still have to go around to go and do our advocacy messages. And they are as follows. Next. For women who receive antenatal care, services to eliminate mother-to-child transmission must be provided. Some pregnant women are not tested for HIV during antenatal care. Some pregnant women have positive tests but are not treated. So the advocacy is we should ask antenatal care providers to conduct tests. They should not miss any test. The test kits are there. We should also ask providers to inform people about their results. Then finally, there should be provider for treatment if any result is positive. And for those that are negative, we keep encouraging them to prevent getting infected. Next. Context 2, when a woman does not receive antenatal care at all, we need to encourage them to do this. And we must ask pregnant women to go to the nearest health facility for antenatal care. Health workers should visit homes of pregnant women to ensure that they are linked to care. And we should identify more individuals in the community that can be champions and mentors. Next. And finally, for children, we need to ask the children, all children of known HIV positive women, to be tested. And if positive, they should be put on treatment. Early diagnosis helps the children to grow normally and to live healthy lives and achieve their objectives in life to the highest level. Next. Thank you very much.
Thank you very much, Dr. Your Excellencies. Because of the importance of this campaign led by our mother, Mama Nigeria, you can see that the hall is jam-packed. Students and even members of the Nigerian National Youth Service Corps, they are all here. I acknowledge all of you. Your Excellency, we have some testimonials, 2 to be precise. We want to take the rep of the network of people living with HIV/AIDS in Nigeria. Then we'll take another one, a rep of Association of Women living with HIV/AIDS in Nigeria. We'll take the testimonials now. Please put your hands together for her.
Good morning, Your Excellency, Senator Oluremi Tinubu, CON, mother of our nation, Nigeria, and all protocols duly observed. So I'm here to share my journey with HIV. My name is Dr. Sokojiro, the Deputy Coordinator of NEP1, Network of People Living with HIV and AIDS in Nigeria, Delta State Chapter. My journey with HIV started like 15 years ago, 2010 precisely. You know, when I was tested, I was like, could it be the end of the world for me? I was down. I took my results. I went to a friend that is a health worker and showed her. She was so supportive. She was not discriminatory. She was friendly. She gave me advice. And when I got home, I showed my husband. Then we are not married. I showed him. I said, this is the test I did today. And you two have to go and do the test too. And he actually went with me. We did the test and we were both positive. So we were placed on life-saving antiretrovirals, which we are taking every single day of our lives. He was supportive. We were supporting each other. My family were also supportive of me. And you know the key to being positive and staying alive is when you have friends, family members, and the community supporting and not discriminating against you for being on medication. So we are supporting ourselves, taking our drugs. We had 4 children. Fortunately for me, all 4 of them are negative, and they are living their lives free. But unfortunately, he died 2 years ago and left me with the 4 children. And my children knew I'm on this medication, and they are supporting me too in taking the drugs. They tell me, Mommy, you've not taken your drugs today. Your time is up for you to take your drugs. And I can remember some health workers that were so supportive, I can't forget them. When I was diagnosed newly, I was so down, but they were there. They supported me, and it was the key for me to being alive today. So for everybody sitting here, especially the young ones, HIV is still very much around. And HIV can be prevented. It can be prevented. The use of protection when having sex. Don't share sharp objects with people. Then for women, make sure you go for antenatal. I went through PMTCT. That is why all 4 of my children came out negative today. So go through your antenatal, come out, be tested early, and if you have the virus, you will be placed on antiretrovirals, and you will live a very healthy life. This is 15 years. I'm looking healthy, I'm okay, I am fine, and there's nothing wrong with me. But I want to use this opportunity to beg for something for people living with HIV and AIDS in Nigeria. You know, these antiretrovirals are every single day we take them. And being that you are on these drugs every day, they are taking a toll on our kidneys and livers. We need to have access to free testing for kidney and liver function. Because recently we discovered that so many of our people are coming down with kidney and liver disease because they are not checking their kidneys and livers. If they are checking, their drugs can be switched to drugs that are friendly, that they can take. But because of access to fund, to get free testing, people are not doing it. And those that are already on dialysis, they don't have access to free dialysis. They don't even have money to. We have those now that are facing that challenges. So I want to plead that if we can have access to free kidney and liver function test, or even a subsidized one, and also for those who are already on dialysis, to have a subsidized fee or even free, so that we can continue to live a healthy life. So HIV is not a death sentence. You can live with it, and you will be fine. You can achieve your potentials in life, even if you are living with HIV. Thank you.
Thank you very much. Let me now bring up the representative of the Association of Women Living with HIV/AIDS in Nigeria. Please put your hands together.
Your Excellency, Senator Remi Tinubu, we welcome you to our state. All protocols duly observed. My name is Nkem Chukwuemeka. I'm from the National Secretary of Association of Women Living with HIV and AIDS in Nigeria. My colleague Dorcas have said it all. I just want to add some little touches. I was diagnosed 26 years ago with HIV, and I've been taking drugs for 19 years now. If you ask me, or if I will be given an award, I'm a big virus, because 19 years is not a joke. Being on antiretroviral day in, day out. The first time I was diagnosed was when I went, 1999, I went for antenatal care. I was pregnant with my daughter. So I was asked to go and do HIV tests, which I did, and it came out positive. My journey started there. But the thing is, I was in a denial stage then, and the thing dealt with me. It actually dealt with me. I was at the point of death. I even had opportunistic infections like tuberculosis and co. At the end of the day, in 2006, I was almost at the point of death. I started taking ARV. And look at me today. I am healthy. I have graduate children. So, my brothers and sisters here, let me start with our with our local government chairman, if they are here. This is an urban area. We need to go to the urban areas. There are places they call hard-to-reach areas. Our women are still there. Some of them don't even know their status. We have a goal of achieving or trying to earn 8 by 2030. If those ones are not being tracked and they are placed on drugs, we cannot achieve that. And again, we don't want any new infection in Delta State in Nigeria. We need to locate them and place them on drugs. HIV is not a death sentence. To our children who are here, I can be your mothers. Yes. I want to tell you guys, please, for those of you that share, our sister Dorcas have talked about sharing sharps. Some of us here share sharp needles, and again, they use it to do ice. Am I communicating? I'm talking to the students. Am I communicating? Yes. So we all should try and stop risky behaviors. We call it risky behaviors. Some of us here, we have girlfriends. If you cannot abstain from premarital sex, or if you cannot be faithful to your partner, you use condom. Please, so that you will not contract HIV. It is not easy. Taking drugs every day. But the first and foremost thing where you will our starting point should be all of us, the students, in fact, everybody here, knowing his or her HIV status, which our sister has already said, it is not a death sentence and it's not the end of the world. So, with these points I've made, please, I'm begging that, especially to our facilities, our midwives here, TBAs, yes, the TBAs, anybody, I don't know if they are here, but if they are not here, maybe they will hear our voices. They should screen any woman that comes to their facility for antenatal. And if found positive, we have on ground mentor mothers in the whole local government areas in Delta State. You can always call us. We are like role models. Immediately you call us, we come to you and do escort services, take you to where you collect your drugs. I want to appreciate the people so far that have even made us to stand tall like this. Saka, they've been so, it is not easy coming out to say that you are HIV positive, and when you talk to them, the next thing you do, you get a hug, a warm hug, to show you that, don't worry, we are with you. I want to thank Saka. I want to thank SASCAP. I want to thank even the doctors in our clinics. They have been so helpful. They don't stigmatize. They don't discriminate. Thank you very much. I wish us a happy and fruitful deliberation.
Your Excellencies, it is thought-provoking. And I'm happy that Mama Nigeria, Your Excellency, is championing this cause. God bless you, ma. Now, we'll take some goodwill messages. We'll take from the DG, National Agency for the Control of AIDS, NACA. We also have from the World Health Organization, Dr. Walter Kazi Mulumbo. Thereafter, we'll take from Dr. Leopard Zinken and Miss Christiane Mandoa, from UNICEF. Okay. Temitope Olori. Temitope Olori, please.
Good morning, distinguished ladies and gentlemen. Your Excellency, the First Lady of the Federal Republic of Nigeria, please permit me to stand on the already established protocol. It is indeed with a great honor and deep sense of commitment that I stand before you today at the flag off of the initiative, the Free to Shine campaign by the Organization of African First Lady for Development and key partners. This embodies the unwavering dedication of African leadership to ending childhood HIV and ensuring healthy mothers across the continent. I want to appreciate our mother, Her Excellency, whose passionate leadership has driven this campaign across the North Central, Northwest, and now the South-South. As we gather here today, we reflect on the significant progress we have made as a nation in the fight against HIV/AIDS. However, we also recognize the threat to sustaining these gains and the need for continued effort. Just last week, many international and even local media were flooded with reports about a shortage of HIV drugs. Allow me to use this opportunity to assure every Nigerian, especially people living with HIV/AIDS, that there is no shortage of drugs or consumables in Nigeria, and there will be no interruption to HIV treatment. Our centers, treatment centers, will continue to provide a steady supply of antiretroviral drugs and uninterrupted care. Under the able leadership of the President Bola Ahmed Tinubu, GCFR, the federal government has taken proactive measures to address any potential shortage of HIV commodities and included 300 billion naira in the 2025 appropriation for HIV, TB, and malaria, in addition to the various Federal Executive Council approvals that had been given for antiretroviral drugs. These interventions are part of government effort to mitigate the impact of the shifting global AIDS policy and to bridge the funding gap. At this junction, I want to appeal to our state governors to please join hands with the federal government to ensure appropriate domestic resourcing for HIV commodities and treatment. We've listened to the various testimonies of people living with HIV that have been on medications, and you can see that it is not a death sentence. Rather, they are living positively and they are free to shine and achieve their potentials. So please, state governors, local government chairmen, let's rise up to the occasion, as you are all aware that there is a shifting policy regarding resources globally from our donors and partners. The Free to Shine campaign therefore serves as a beacon of hope, reminding us that together we can create a brighter future for our children. This campaign is not just about policies and programs, it's about the people. It's about ensuring that every woman, every child is free to shine, free from the burden of HIV, hepatitis, and syphilis, and free to pursue a bright and healthy future. NACA therefore stands in solidarity with this campaign, and we pledge our commitment to aligning with all the multi-sectorial sectors to ensure that we achieve our objective and aim collectively as a nation. I therefore urge all to join us in this fight, and I say thank you and God bless you. Thank you all.
Thank you very much. Your Excellencies, distinguished ladies and gentlemen, let me bring up the country representative of the World Health Organization, WHO, Dr. Walter Kazi. Please. Let's put our hands together for him.
Your Excellency, Senator Oluremi Tinubu, First Lady and Mother of our nation, Executive Governor of Delta State, distinguished invitee dignitary, ladies and gentlemen. My name is Dr. Walter Kazadi Mulombo, because I've heard 3 names already this morning. So it's really an honor, Your Excellency, to join you in this occasion and participate on the launch of the Free to Shine initiative in Delta State. This is the third zone I'm witnessing in Nigeria to adopt this initiative and highlight country dedication to ending mother-to-child transmission of HIV/AIDS, viral hepatitis, and syphilis. And I want to take this opportunity to emphasize HIV is not a death sentence, syphilis is not a death sentence, viral hepatitis is not a death sentence, because you are here to talk about the three. Your actions, Your Excellency, inspire national progress, setting a powerful example for health advocacy across the country. By the way, I'm facing pressure among my staff. They all want to have you as champion of the various health areas. And one of them is antimicrobial resistance, which is very relevant to our efforts to the three diseases. And Nigeria will be hosting the Ministerial Conference on antimicrobial resistance next year. So they will ask me to ask you to consider being a champion also for antimicrobial resistance. Your Excellency, we would like to take this opportunity to commend bold steps taken by Nigeria, including mobilizing, committing additional resources to tackle HIV, tuberculosis, and other diseases. Nigeria is setting an example globally. Nigeria is not just crying, it's taking political action, decisive action. And we would like to commend Nigeria for that. Your Excellency, thanks to concerted effort, your effort, government, and partner, Nigeria is making significant progress toward epidemic control by 2030. And we are confident if that determination is maintained throughout the years, Nigeria will be among the countries that will communicate success in this endeavor. I would like to use this opportunity of the Free to Shine campaign in the South-South as the third geographical zone to also join you to adopt this initiative, which is pivotal to address these challenges and build Nigerian success. We urge that the campaign be tailored to the unique needs of these regions and women and children and the population, expanding testing in health facilities and communities, providing prophylaxis for exposed infants, and ensuring treatment for those affected. We are lucky that the Mother of a Nation is championing this initiative. It will provide the needed impetus to reach the finish line. This launch also opened doors to strengthen maternal and child health beyond the triple elimination. We need to increase the number of mothers who are attending the 4+ antenatal care session. We want children to benefit from the birth dose against hepatitis B and also routine immunization for maternal health program, which can amplify outcome. Empowering our women will be a key. WHO, my organization, stand ready to continue to work alongside Excellency Safe City and the government to eliminate vertical transmission and enhance health outcome for mother and children. We can count on all leaders in the South-South zone and beyond to seize this moment, harnessing the moment which is created by the First Lady to achieve outcome. And we would like to commit to work with the local government chairman in the context of LGA financial autonomy to help them grab the opportunity and extend this effort beyond health facility to the community. In conclusion, once again, congratulations, Your Excellency, congratulations to OFLAD, congratulations to Federal Republic of Nigeria and the First Lady, the Mother of a Nation, for advancing this bold initiative in South-South Zone. I thank you for your attention.
Thank you. I apologize in case I murdered your name. Let me welcome Dr. Leopard now from the Country Director, UNAID.
Thank you, MC. I'm Leo Zeken. I'm the UNAID's Country Director. Your Excellency, the First Lady of the Republic of Nigeria, the wife of the Vice President, His Excellency, the Executive Governor, I want to align with existing protocol in the interest of time. I feel honored, I feel privileged to have been invited. I bring you warm greetings from your sister, Winnie Bianima. Winnie will have loved to be here to appreciate your leadership, to appreciate your commitment. But if the next flag off in some of the states are planned ahead, Winnie may want to come here, Your Excellency. We'll discuss with your team. We are here as UNAIDS to show support, to show solidarity, because this is a laudable initiative. Children should not be born with HIV. Children should not be born with syphilis. Kids should not be born with hepatitis, because we really have the tool. We were with you in Kwara. We were with you in Kaduna. Today we are here in Delta, and we can commit that tomorrow, whatever you will be flagging off, will be with you. I also want to commend your team with seeing some innovation, so in the program, so bringing in testimonies, so having voice of those who are feeling it is really making a difference. And also Dr. Bashron to contextualizing the flag off and then showing where we are, so in the South geopolitical zone. I think it is important. Allow me also to add my voice and commend you. It takes leadership, it takes courage, it takes passion. You have so many things to do as the First Lady to really come and embark again on yet another initiative. Really want to commend you, so for that. The State Minister of Health, we have had difficult conversations with your team in the program performance. And it is really heartwarming to see that between 2003 and 2023 and 2024, the number of pregnant women who were tested for HIV increased from 2.8 million to almost 5.2 million. This is commendable, so we also are happy to note that we've increased our reporting sites from almost 20% to 80%. Again, it shows that it is possible. It shows that Nigeria can do it. And the coordinating minister challenged me in Kaduna that Nigeria can, Nigeria should, and Nigeria must, and Nigeria is showing the way. It was very emotional in Kaduna to see all those women coming and saying what they are going through. We're also very emotional this morning, so to see you attending to them. And it gives a powerful message out there. It would be good if by World AIDS Day we can see all the First Lady in all the states, so in the local media, doing the same thing to address stigma and discrimination. That would be extremely powerful, Your Excellency, the First Lady. Why am I saying it? I'm saying it because despite the positive experiences that we've seen here, stigma and discrimination is still a major challenge. People will tell you what kills them is not the virus. What kills them is how the society look at them, how the family look at them, how people in the workplace are really looking at them. And in a survey that was conducted a while ago, 47% of Nigerians, to the question of, will you allow a child living with HIV and AIDS to go in a school where other children are HIV negative? 47% say they will not allow, so the child, to go. It speaks volume. 22% of the people living with HIV and AIDS in a survey done recently, they're still facing stigma and discrimination. This beautiful country, Nigeria, in 2014, there was an Anti-Discrimination Act promoting the rights of people living with HIV and AIDS. 10 years ago, only 19 states, 19, have domesticated the Anti-Discrimination Act. So I think it is important that we really put our heads together to see how we can end stigma and discrimination. If Nigeria wants to end AIDS by 2030, it is important that we have collective, inclusive action, so to end stigma and discrimination. UNAIDS is committed, working very closely with NACA, working very closely with NEPWAN, ASHWAN, the House of Rep, to make sure that we live in a society, just as the First Lady of Delta State mentioned, where there's no more people infected with HIV, syphilis, and hepatitis, a world where, so people can feel free in doing what we are doing. I end by committing UNAIDS, and again, God bless you, your First Lady. God bless you, give you more life and strength in such a way that you can continue to do the things that we're doing. Thank you so much. God bless Nigeria. Okay.
Thank you. Please, let's do it one more time. Your Excellencies, distinguished ladies and gentlemen, we want to do a little drama to depict what we're here for. And so I'd like to welcome this award-winning troupe, the Delta State Arts and Culture Troupe, for the drama. Good time.
Na lie. Neighbors, mona come. Ewa, mona come. Another yo. Ewa.
What is going to happen again for this compound?
Cynthia, my friend, don't die yo.
Cynthia. Hey.
Cynthia don't die yo.
Cynthia don't die. Oh, come on. Rakapapapalaba. Cynthia die.
Fresh Cynthia, that fresh girl don't die.
Hey, that my Pino Cynthia don't die. Hey. Wait. Do you mean Cynthia, my spiritual daughter?
That's
my prayer warrior?
That's why I see.
No, that can't be. That's a big fat lie.
That's why I see. No. And they listen to my radio. Now the radio call it say anybody when get crow for back, go get sore for his mouth. He call the cough, no they finish. He said HIV. And Cynthia tell me say he gets sore for mouth. He cough, no they finish. He get rashes for his body. That will not be HIV.
No HIV.
And that's so Cynthia don't die.
What did they happen now? Why everybody face there like this? My wife.
Cynthia
Papa, Ejiro, my husband. That was Cynthia. Oh, they said you get all that, you're that fine girl.
Hey! Hey!
They say na HIV.
Hey! Wait till you dey scratch. I just dey watch you. Since I don't go die, scratch. Wait till you dey scratch. Since when I enter Cynthia room, go watch him. Since I can't discover say something dey scratch me. He dey scratch. Na syphilis o. Na syphilis o. It can be fatal. Men are coming from my body. Na syphilis. I said, can somebody put me in the know? What is the commotion all about here?
Now sit here and die. HIV kisses.
HIV. Well, a solution they say you get cure sharp, but you every time now they see you and Cynthia for one corner. You go swear say you never carry that memo. And even you, every day now you and they run things. So now you don't carry syphilis with that. I beg, don't they pretend. Which one be kapaya? First of all, they pretend. Every time when people don't come out for compound, you go inside Cynthia's house in the name of deliverance. You never carry syphilis. No, that's not true. I was only conducting deliverance. Pastor, stay one place. Don't they speak that in tongues. Now they invest me. And you, when your wife don't go market, you go they enter Cynthia's house.
Whose wife?
Now, see what you they do now. This death where they get die now, they are affected because you know say don't carry me.
Papa Ejiro, my husband, what did I do you? No wonder you the whole year.
No, listen. Suya, go give am for that day. Listen, make una listen. Wetin they be say, as he be say, una they do unprotected sex. Wetin happen be say, all of us go meet my doctor. Now, oh yeah, everybody go. We'll go conduct test. Now. I don't carry my community people come.
Okay.
So then we come here, make you give us sex education for this your office. Now make us come.
Thank you so much.
HIV education, just give everything.
Thank you so much. Thank you for joining in this fight, my friend. I appreciate it. Okay. Good morning, people. Good morning.
Doctor.
Good morning. My name is Dr. Ann. You're welcome to my office. Okay. My friend here has told me so much. So let me just go straight to the point. Let me sensitize you people on these diseases that is ravaging the community. Many of us don't know. Okay. I want to let you know that HIV/AIDS, syphilis, hepatitis, they are serious diseases that if not well looked into, can cause loss of life and cause calamity in the community. Yes.
Please, doctor, what can we do to prevent HIV and syphilis?
Okay, it's a very good question. Abstinence. Yes, abstinence. Stay away from sex. Premarital sex, unprotected sex. You have to be faithful to your partner. Yes. But in case you don't feel whole body like they usually say, please use protection. Use condom. Yes.
But, doctor.
Yes. And please, let me finish. Please. It is not just that. You don't get it through sex alone. Yes. Using sharing objects, sharp objects with people who are infected, you can contract it from there too. So we have to be careful because it's not a show for face.
But, doctor.
Yes, dear.
I thought our tradition, culture, and religion would have been able to save us from this deadly disease.
You are correct. Our religions and traditions are okay. They are good. But sometimes they are not enough. Yes, they are not. We need to combine our cultural practices, our religion, with modern method of preventing and curing HIV/AIDS and other sexually transmitted diseases.
Doctor, this is where they talk good, tra. But all these our small children when they grow, you know, say that they walk away. How we want to prevent them from all this disease? Where you they can't now?
This one is more touching, madam. This your question is more touching because our children are our future. Yes. What do? We start early. Catch them young. Start educating them from the beginning. Where do we start from? From the little ones. You teach them how not to pick sharp objects from the ground that people have already used. You don't know who used them. Then for the ones who are adolescents, you know, you can follow them everywhere they go. What do? You sensitize them. You tell them the dangers of having premarital sex, unprotected sex, so they can be safe. That is it. My people, I want to beg us. Let us all join hands together to see how we can fight against these diseases. HIV, AIDS, hepatitis, syphilis, and other sexually transmitted diseases. It starts with us. Let us work together so we can have a healthier, a safer, and a more productive community.
Pastor!
What is it? What is it?
I feel say you don't die. Where you can't go?
Sister Cynthia.
I no die, and I no go fit die.
Hey!
I get work where I go attend to. Na job interview, na here I go.
We know say you carry this mewo wey dem dey call HIV. How you take survive am?
I survive it because I sought for treatment. And I have been taking my medication. And even the company that employed me, they did not abstain themselves from me. Rather, they show me love and kindness.
Hey! Now good news, now you tell us so. This one show say, this news where you dey talk so, na better thing for all of us.
This is it.
That one show say, proper medication and support for people who get HIV. Now be say, that right support where they give them, go make them go try for our community well.
Yes! Beto, Cynthia, which message do you have for every one of us here?
I don't have much to say. Dr. Ann here has already explained it all to you people. Because she is my confidant.
Yes, we usually have this heart-to-heart talk. I know her very well. Cynthia's case here, it's one of hope and resilience. I want to beg us all. Let us go and get tested so you can know your status.
Exactly.
Peradventure you are positive, please don't kill yourself. Don't die before your time. It is not a death sentence.
At all.
And for those of us who don't have this virus, please, let us learn to support those who have it so that together we can build a supportive and a more resilient society.
Yeah.
AIDS is real. It no get cure. People no dey know person wey get am o. AIDS is real.
AIDS is real.
It no get cure. People no dey know person wey get am o.
Put your hands together for them. So the drama talks about hope. No wonder Mama Nigeria is here with the Renewed Hope Initiative. Please put your hands together for Her Excellency. Having done that, we'd like to get some remarks. First, from the Honorable Minister of State, Federal Ministry of Health and Social Welfare, Dr. Ezak Adekunle Salako. Let's put our hands together for him.
Thank you very much. Your Excellency, Senator Oluremi Tinubu, CON, the First Lady, Federal Republic of Nigeria, National Chairman, Renew Hope Initiative, our global and national champion to NTB, member of the Steering Committee of the Organization of African First Ladies for Development,
our own chief champion for the health of Nigerian women and children. And I want to add my voice to WHO to also request that you should also kindly accept to champion again the campaign against antimicrobial resistance. Your Excellency, Ajia Nana Shetima, the ever-supportive wife of our Vice President and National Vice Chairman, Renew Hope Initiative, Your Excellency, the Governor, and the First Lady of Delta State, thank you, Your Excellency, for being a very good hostess. Other First Ladies here present, the wife of the Chief of Staff, wife of top government functionaries, our esteemed development partners, special thanks to WHO and UNAID for your partnership, and also for amplifying the progress being made under President Bola Ahmed Tinubu. Under our dear President, things are obviously getting better. Gentlemen of the press, all protocol duly extended. First, let me announce that the presentation by Dr. Bashorun will be uploaded on our website, www.health.gov.ng, for those interested in perusing it further. HIV, syphilis, and viral hepatitis continues to pose significant public health challenges in Nigeria, contributing to maternal and child mortality, undermining socio-economic development, and placing a heavy burden on families and communities. Against this background, I am confident to assert, without any equivocation, that with interventions such as this Free to Shine program, Our Excellency Senator Oluremi Tinubu, CON, is truly renewing the health of Nigerians and helping to secure a healthier future for our country. Your Excellency, Ma, yesterday we were here to witness your intervention for the South-South region of our country, geared towards the betterment of the health of pregnant Nigerian women and our newborns. Today we are here again under your direction to amplify our voices and work towards the triple elimination of HIV, syphilis, and viral hepatitis, 3 diseases that significantly contribute to morbidities, disability, premature death, and holds our people down from achieving their full potentials. Your intervention to end TB in Nigeria, to reduce the burden of cervical cancer in our country, improve nutritional status of our people, upgrade the livelihoods of many Nigerians, has become an invaluable component of the Renew Hope agenda of President Bola Ahmed Tinubu, GCFR. Your relentless commitment to bringing together key stakeholders and harness political commitment at the highest level in the pursuit of the noble goal of improving the health and productivity of Nigerians has been phenomenal, and it is catalytic in helping us to get things done in the health sector. I wish to therefore appreciate you, Ma, for your passion, your dedication, and commitment, which is giving Nigerians, especially women, children, and youths, the leverage to shine, free from preventable diseases and from poverty. Today, global health is facing a crisis of significant funding gap and program sustainability, with the health of the public in developing countries of the world particularly facing challenges. Nigeria has responded to these challenges by prioritizing local and increasing domestic funding, self-reliance for our nation's health sector. We are integrating our response to diseases of public health significance like AIDS, TB, and malaria, tailoring our programs to the specific health needs of our people, improving community participation, addressing inefficiencies in the system, and prioritizing preventive health intervention. President Bola Ahmed Tinubu, as part of the Renew Hope agenda, identified the health of Nigerians as an urgent matter of right and is anchoring his vision to save lives, reduce physical and financial pain, and produce health for all Nigerians on an innovative, broad-based, system-wide blueprint, the Health Sector Renewal Investment Initiative. Consequently, the Federal Ministry of Health and Social Welfare is implementing several initiatives. To ensure that the health of Nigerians is secured. Let me, at this point, thank once again Our Excellency for your passion, for your support, and for amplifying this intervention. Distinguished ladies and gentlemen, I am bold to say that under the Tinubu-Shettima presidency, with this committed support of our mother, the First Lady of our country, ably leading other First Ladies at the subnational level, Nigeria is on the path to freedom from preventable diseases, poverty, and premature deaths. On behalf of the Federal Ministry of Health and Social Welfare, I commend the invaluable contribution of the mother of our nation to keep our feet firmly on this path. I also thank Her Excellency, the wife of the Vice President, our First Ladies at the state level, and wives of top government functionaries for the wonderful roles you are all playing in furthering the welfare agenda of the Renew Hope Initiative and the Organization of African First Ladies for Development, which is impacting positively on the health sector of our country. To our dedicated health workers who are on the front line of care, delivering hope, treatment, and compassion to those who need most, I commend you for your steadfastness, your dedication, and for standing with our country. In conclusion, let me once again pledge the full readiness of the Federal Ministry of Health and Social Welfare to continue to cooperate with the Office of the First Lady in the determination to make Nigerians free to shine, free from the burden of preventable diseases, free from the limitations of inadequate health care, and free to pursue a healthier and brighter future. Before I end, let me comment on the request by Madam Dorcas of NEP1 with respect to free liver and kidney function tests and free dialysis for people living with HIV and AIDS. Let me say that as soon as I get back to Abuja, we're going to do the costing and see the possibility of incorporating free annual liver, free annual liver and kidney function tests to qualified people living with HIV and AIDS through our catastrophic health insurance scheme. Let me also inform you that Mr. President has approved 80% subsidy for kidney dialysis across some selected federal tertiary health institutions. We will work towards increasing this to 100% subsidy. Thank you, and God bless the Federal Republic of Nigeria. Thank you all.
Thank you very much, sir. Please, let's give him another round of applause. Your Excellencies, distinguished ladies and gentlemen, I like to, at this point in time, bring up His Excellency, the Governor of Delta State, my boss, a man who has made it possible for women to go to our hospitals to deliver free of charge and take care of those children up to the age 5, free medical care in Delta State. His contributory health insurance scheme is second to none. Now, if you are a enrollee, all you need to just go to government hospitals and you are treated free of charge. May I now respectfully invite His Excellency, Right Honorable Elder Sharif Francis Orokwedo Borobori, JP, Governor of Delta State. Ukodo.
Please sit down, please sit down. Our dear mother, Mama Nigeria, Her Excellency, Senator Oluremi Tinubu, CON, wife of the President of the Federal Republic of Nigeria, and National Chairman of the Renewed Hope Initiative. We welcome you. Her Excellency Aija Nana Chetima, wife of the Vice President of the Federal Republic of Nigeria. Your Excellencies, wife of the governors, here present, particularly my dear wife, Dickness Tubori Oborewori. Let me also recognize the wife of the Chief of Staff to Mr. President. Thank you for coming to Delta State. Like what Mommy said, so you are looking good in Delta. So, thank you. A dear Honorable Minister of State, Dr. Saloko, you're welcome. The wife of the Deputy Governor of Delta State, Sir Modi Yemen. I welcome all of you for coming here to Delta State, most especially the country rep of the World Health Organization, Dr. Walter Kazadi, other top government functionaries. Mr. Speaker, I recognize you and your dear wife, Deputy Speaker, principal officers of the State House of Assembly. I'm aware that on Tuesday and today, you decided to adjourn plenary because of the visit of the First Lady. Transmitted diseases and sexual
Good morning, Marina Station and all the passengers.
Efficient, it's comfortable.
This development will go a long way in reducing congestion and emission.
The trains are a long-term solution to Lagos traffic challenges.
This is where we take the final, decisions on policies, programs of government that will have to ensure that, the narration of Lagos as a PLC is taken very, very seriously.
This is a major pedestrian bridge linking Oyingo here to Apapa Road over there.
With this overpass, we are providing what we call a permanent solution.
This place is one of the most dangerous areas at the biosecurity environment.
This can go into the news and every crumbs of your neighborhood.
Our goal is to remain as Africa's model megacity, to move our GDP from the 5-6 position to the 3rd position, and we believe is achievable with all the commitments we have.
Explore the city of Lagos
where dreams are made and possibilities are endless. Amadedoja Salamadini. I live in Lagos, inside Lagos.
Hello, TVC Communications. How can I help?
What makes TVC the right choice for my business?
Excellent question, sir. Let me share some exciting facts with you.
Start your day on TVC Entertainment with Wake Up Nigeria, a family and lifestyle show. Your view empowers women globally.
It's your view, let it count.
Entertainment Splash delivers the hottest celebrity trends. On TVC News, we keep you informed with breaking news and in-depth analysis of events shaping the world.
I will continue to speak the truth.
TVC News at 7 and TVC News at 10 p.m. delivers the most important stories of the day. Max FM, your hit music radio station, captivates listeners daily across Lagos and Abuja, making every commute more enjoyable. Adaba 88.9 FM is not left out, as it is the voice of Southwest. And on TVC Digital, we reach to million viewers daily. All together, pulls in over 17 million viewers daily. Contact us on 0707 272 8338 or marketing at tvccommunications.tv. Partner with TVC Communications today. Let's grow together.
The Inspector General of Police has met with senior officers to review the state of security.
We are continuing our coverage of the arrest of Godwin Emefiele.
The Senate has summoned the governor of the Central Bank of Nigeria to properly brief the Senate.
They will be in a better position to make better decisions regarding their choices in life. Hence, we consider ourselves partners with Your Excellency and Offland in the campaign against these public health challenges. On this note, I wish you a very successful campaign, and I know you're going to do very well. We are living here. I have been told that next month we are going to Taraba. Taraba will also host you very well. Thank you for the good work you are doing. God bless the Federal Republic of Nigeria. God bless us all.
Yes, indeed. It has been His Excellency, Right Honorable Elder Sharif Badawari, Governor of Delta State. Your Excellency, Ma, we want to dance. We want to dance. Just small, 2 minutes before Mommy comes up. 2 minutes. Thank you, Ma.
Mommy, abiyamo, abiyamo. Ni kenyi sise, abiyamo, abiyamo. Ni wayi lawati, abiyamo, abiyamo. Ajido ni kulowo ni, abiyamo, abiyamo. Abiyamo, Etewádure, Abiyamo. Mommy, Nigeria no go die for your hand. Abiyamo, Etewádure, Abiyamo. I say you no go die for your hand. Abiyamo, Etewádure, Abiyamo. That is say make I tell you. Abiyamo, Etewádure, Abiyamo. Wọ́n ní wáyé la wá tì. Abiyamo, Etewádure, Abiyamo. Ẹ̀jẹ̀ ní sọ́kún. Etewádure, Abiyamo. Àníkẹ́ tẹ́wọ́ àdúrà o. Abiyamo, Etewádure, Abiyamo. Àníkẹ́ tẹ́wọ́ àdúrà o. Abiyamo, Etewádure, Abiyamo. My governor, you no go die. Abiyamo, Etewádure, Abiyamo. Your wife no go look for you. Abiyamo, Etewádure, Abiyamo. Mommy, Etewọ́ àdúrà o. Abiyamo, Etewádure, Abiyamo.
dances, I'm always amazed at, the culture we have. And what we've seen here today, at least over time we are evolving, is a national fabric. You can see the Edo is dancing to the song of people from Benue, and they are all together. You've really spoken with that dance that we are all one. Thank you so much. And I think the future is really, when I see that, I believe that girl. Every time I come to Delta, it always rains. So I'll be water girl. So it is well. The heavens is acknowledging that I'm home. Yes, yes. Thank you. I'm always so happy when I come to Delta. I know they've recognized all of you. The only people I know that they will charge me is the Delta State House of Assembly, Right Honorable Emomo Timi Gwowo. His wife, Mrs. Timi Gwowo. Did I say it right? And other members of the House of Assembly here present. Members of the Delta State Executive Council. And also all our development partners present here, including the DG, NACA, Dr. Temitokpe Ilori. Thank you so much. They called you Ilori. Is Ilori? National Coordinator, National AIDS and STD Control Program, Dr. Adebobola Basharon. Thank you so much for the presentation. And WHO Country Representative, Dr. Walter Kazadi Mulombo, UN AIDS Country Director, Dr. Leopard Zekens Achenzgu. I hope I did well. I'm trying. Religious leaders here present. Our dear, strong, and brave survivors who will listen to here today, you can see that, AIDS is not a death sentence. And I was listening to them. Most of us here are on lifetime medication. And so it doesn't mean that ours is not, something that is transmissible. But, some of us, most of the people here are on one medication or the other. I take 2 medications every day, one in the night, one in the morning. And as you grow older, your body is, you have to, even if you buy a new car, you have to always service the car. So you have to service this body. And that's why when you see me this year, I'll be 65. But, God has been so good to me because I'm doing the necessary health adjustment. So all of us, you are either on blood pressure medication or on cholesterol medication, different medication. But we thank God. And some you can always have a lifestyle change to maintain yourself. But and we women, when we get to menopausal stage, is another journey on its own. It's like your body is shutting down and you have to adjust. So HIV is no killer. TB is no killer. Just make sure you get treated. Please. Those two, because they are contagious, you have to get treated. That's why we are here today. But I'm so glad that our young people, and I see them just looking at, as if they are invisible. So please, we have to do what is right. So members of the 4th Estate of the Realm, thank you so much for these 2 days of, covering us. And her troop, you are simply the best. Simply the best. Thank you so much. I am honored to officially launch the Free to Shine campaign in Asaba as I conclude my 2-day working visit to the state. And our royal mothers that are here, God bless you. God bless you. Forgive us. So I just remembered now that we didn't mention you. Thank you for always being there. The Free to Shine campaign is... Did I mention the youth corpers? I'm dead. Great Nigerian youth. Great Nigerian youth. I know they will say, Great Nigerian youth, Gbogbo. 3 gbosas to you. Gbosa, gbosa, gbosa. God bless you. I know they are sad that I didn't do the chant very well. Next time I'll do it right. But I'm so glad you are here too. And thank you to the governor for mobilizing them this much. I'm really grateful. So the Free to Shine campaign is an advocacy initiative led by the African Union, the Organization of the African First Ladies for Development and Global Partners. The goal of this campaign is to address the growing complacency in the response to the spread of HIV/AIDS in Africa, Nigeria being the country with the highest burden of HIV/AIDS in sub-Saharan Africa due to its large population, faces significant challenges. This burden is particularly severe among children, youth, women, and marginalized groups. Thinking that is only with women, no. You can hear a survivor who spoke now that even the husband passed, one of them said the husband passed because of this complacency of not taking your drugs. So it's for every human race. If you contact it, it's both from the women, and other ailments is from men to women. Okay? So it's not, and all the marginalized groups. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. The campaign will cover 6 geopolitical zones of the nation. We launched the maiden campaign for the North Central Zone in Kwara on 30th January 2025, and that of the Northwest Zone in Kaduna on 2025 February and 25th February 2025. Today we are flagging off the campaign in Delta State for the South-South Zone. By the grace of God, the next zone to benefit will be the Northeast, and Taraba states will be the host. The Free to Shine campaign seeks to significantly reduce new HIV infections among women and reproductive age, prevent mother-to-child transmission, vertical transmission, and ensure that every child born with HIV receives the necessary treatment for support to thrive. According to the Federal Ministry of Health and Social Welfare, in 2024, there were over 100,000 children and nearly 2 million adults living with HIV. Also, it is reported that most infants born to HIV-positive parents are not tested within the first 2 months of birth, largely due to the fact that the mothers are not aware or they are ignorant of the consequences of their inaction. It is heartbreaking to know that just 2 years ago, 15,000 children aged 0 to 14 lost their lives in AIDS-related illnesses. Each of these children was not just a statistic, but represented a future full of potential, but was sadly cut short. The ongoing challenges faced by these children emphasize the urgent need for sustained action to improve prevention strategies, enhance diagnosis, and expand access to treatment. In Nigeria, hepatitis and syphilis are major public health concerns. Experts highlight that hepatitis, especially hepatitis B and C, poses a significant threat as it can lead to chronic liver disease and even liver cancer. If syphilis is left untreated, it can result in miscarriages, stillbirth, congenital abnormalities, and neonatal and infant deaths, among other complications. The goal of this campaign is to raise awareness, renew our commitment, and take collective action against these diseases. This, I believe, aligns with our shared vision of a healthier Nigeria where every individual, particularly women, youth, and children, can thrive and live healthier lives. This vision is in line with the renewed hope agenda on health of His Excellency President Bola Ahmed Tinubu GCFR, which focuses on health as an essential pillar of development. Nigeria is at a pivotal stage in her fight against HIV/AIDS and is poised and ready to join other countries in Africa who have achieved the UNAIDS 95/95 target by 2030. The aim of this target is set to see that 95% of the people who are living with HIV/AIDS know their status. 95% of those who are aware of their status are placed on life-saving antiretroviral treatment, and 95% of people undergoing treatment achieve viral suppression, which means they cannot transmit the virus to others. We must deepen engagement with traditional faith-based institutions to address cultural and religious influences on HIV prevention behaviors, especially those engaging in birthing services, by expanding access to HIV testing services with comprehensive counseling, treatment, and care for all individuals who test positive. I want to commend the members of the Association of People Living with HIV/AIDS for their testimonies. Their stories serve as a powerful reminder of resilience and hope, inspiring others living with HIV/AIDS to seek support and treatment they deserve with courage and confidence. I thank all our health workers, the National Agency for the Control of HIV (NACA), National AIDS and STD control programs, as well as research and public health institutions for their efforts in combating HIV/AIDS, syphilis, and hepatitis through the years, as well as our global partners helping us in this fight. I especially recognize WHO, UNAIDS, UNICEF, UNDP, PEPFAR, and the Elizabeth Glacier Pediatric AIDS Foundation, amongst others. I said PEPFAR because they used to help before Trump came, but I think Trump will understand better. By the time, when time goes on, he would understand better. We must intensify efforts to ensure that the global triple elimination target of HIV/AIDS, syphilis, and hepatitis is achieved by 2030. I believe that the concerted efforts of all stakeholders here present, especially the state first ladies, who will disseminate this message in their various states, this deadline can be attained by the grace of God, and I rely on you all to do the needful. And I want to thank UNAIDS for reminding our first ladies again. I know some of you are doing what you should do concerning this and also TB. We've done our quarterly meeting. We still want you to do it in our local dialects and also be there. And advocacy is the key for us to live free of all these transmissible diseases that we can avoid. Please, you are all here. Mrs. Uzodima, you are the one here representing the Progressive Governors Forum. Pass it on. I speak to Mrs. Abdurazak all the time. She will do the needful. Please, you see, UNAID have reminded you again. So I'm counting on you to do that. To our dear children and youth, this campaign cannot succeed without your involvement. You represent our future generation. However, your age group is one of the most vulnerable. Please care and protect yourself. Take good care of yourself and protect yourselves. In the coming days, we will witness more advocacy in the media in all the 36 states of the Federal and the Federal Capital Territory. We have started with the Federal Capital Territory already, and also we are on radio, and we are doing the best we can. Finally, I would like to express my gratitude to Your Excellency, the Governor of Delta State, Right Honorable Sheriff Francis Oborewori, and his lovely, lovely wife, the First Lady, Her Excellency, Mrs. Dickiness Tobore Oborewori, and good people of Delta State, for the warm reception and kind hospitality throughout our stay. We've enjoyed our stay. They said we shouldn't leave again, that we should wait, and those of us who are not fasting, wait to enjoy their food. They said we wasted their food yesterday. So I'm going to stay back. And God bless our children, youth, and mothers that are here. And the fathers too. God bless you. God bless Delta State. God bless the Federal Republic of Nigeria. Thank you so much.
Thank you. Mommy, we will take a session of photograph. I've been directed, Your Excellency, Vice President's wife, Minister, sir. Mr. Speaker, I've been told that you should join in this photograph, and Her Excellency, the wife of the Deputy Governor. It's a session of photograph. Thereafter, the representative of the children, the youth and the children. Mommy, before you came, the children were so excited when I told them you were coming. They were singing. They are happy to see you, man. Okay. Yeah, the representative should stand by. Stand by.
Olúrẹ̀mí lọ́ba gbéra lẹ̀. Olúrẹ̀mí lọ́ba. Olúrẹ̀mí lọ́ba. Obirikiti o, obirikiti o.
Some will come this way.
Iṣu diyan, àgbàdo parada o, àgbàdo. Lọ́ba gbéra lẹ̀ kó dìde, gbéra lẹ̀ kó dìde, gbéra lẹ̀ kó dìde, gbéra lẹ̀ kó dìde. Obirikiti o, obirikiti o. Iṣu parada, iṣu diyan, àgbàdo parada o. Olúrẹ̀mí lọ́ba gbéra lẹ̀ kó dìde.
Thank you. Thank you. The youth's mommy. Yes, the youth present. Yes. Okay, minister, the speaker, and his wife can also.
Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba. Gbéra lẹ̀ kó dìde. Obirikiti o, obirikiti o. Iṣu parada, iṣu diyan. Àgbàdo parada o, àgbàdo. Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba. Senator Olúrẹ̀mí lọ́ba.
Mommy is arranging the photograph herself. Oh, what a delight. You are a blessed child. I advise that the photograph be enlarged. That. Oh, this one. Okay. Thank you, thank you, thank you. Development partners will join. Yes, the children can go now. Core members can leave now. After this, the wives of governors and wife of ministers and the wife of National Assembly and members of National Assembly. Yes, development partners. After now, the wives of the governors. The state assembly members that are here should also stand by. Thank you very much. The governor's wives will now join.
Welcome back from the live telecast. We'll now continue with our regular programs. Stay tuned.
Thank you for staying with us on TVC Midday News. The Center for Digital Humanities at the University of Lagos has launched its first ever Lagos Spring School in digital entrepreneurship and digital cultures. The intensive capacity building program brings together young professionals, scholars, and